Hi, we will be learning about the treatment technique in this part of lecture. And the first treatment technique that we are going to discuss is reframing. Reframing involves the use of language to include a cognitive shift within family members and alter the perception of a situation as different interpretation is given to a family's situation or behavior. It is a circumstance that gives a new meaning, and as a consequence, other ways of behaving are explored. Reframing does not change a situation, but it makes the alteration of meaning which would invite the possibility of change. For example, depression may be conceptualized as irresponsibility or stubbornness or a coping strategy. So we replace the heavy terms with positive and constructive one. Another example, anxiety may be reframed as excessive concern or a nervous response. In other words, reframing helps to establish rapport between the therapist and the family, and it would break down resistance. Reframing also utilizes to reduce negative effect in family interactions while creating a motivational context for change. For example, consider a case in which a father is angry at his daughter for getting pregnant. The daughter withdraws emotionally as her father vents his anger at her. The therapist reframes the father's anger into caring by stating, I can see how concerned you are for your daughter. You had so many dreams for her, and you are worried that they will not be possible now. You must have a great deal of love for your daughter for her missteps to make you so angry. And the father probably would be responding as, you are right. I'm afraid that she had ruined her future. And she could have HIV. She won't tell me if she has been tested. The therapy then would return to the daughter and say, did you know that your dad is worried about you? Another example, a father who constantly pressures his son regarding his grades may be seen as a threatening figure by the son. Reframing this conflict would involve gently steering the conversation into focusing on the father's concern for his son's future and helping the sons to hear his father's concern instead of constant demands for improvement. Reframing serves as a natural springboard for restructuring interventions that transform family relations from problematic to effective and mutually supportive. Such restructuring intervention include directing or blocking communication, changing family alliances, helping families to develop conflict resolution skills, developing effective behavior management and conflict resolution skills, fostering positive parenting and parental leadership skills, so on and so forth. All of these interventions involve assigning in-session tasks followed by out-of-session homework tasks once the in-session tasks are progressing well. For example, parent might be asked to engage in a conversation about managing the adolescent's behavior, and the therapist will block the adolescent from interfering with the conversation. Another example, an adolescent and a disengaged father figure might be asked to engage in a collaborative task together as a way of building a positive relationship. If it is successful within therapy, these activities would then be assigned as a homework task.